Calcium chloride, widely available as a generic, so there's not really any trade names out there for it. It is an electrolyte. It's an anion. That's the class. Mechanism of action: increases the force of cardiac contractions. It is a positive inotrope, and it also stabilizes cardiac cells, especially in hyperkalemia. Pregnancy class is C. So some indications for it: hyperkalemia with ECG changes. You get big peak T waves, widening of the QRS. Hypocalcemia, that we're going to have to draw labs for to see that usually. And then beta blocker and calcium channel blocker overdose. If you just increase the amount of calcium in the blood in the calcium channel overdose, calcium channel blocker overdose, then you're counteracting those effects. Some contraindications for it: ventricular fibrillation and then digitalis toxicity. Adverse reactions with this drug: bradycardia, dysrhythmias, hypotension, cardiac arrest, vasodilation might happen. So you might have some nausea, vomiting. And then it's very irritating to the skin, and it might cause some tissue necrosis at the injection site. That's why it's important to make sure you have a very good IV before you give it. Some drug interactions: if someone is on digitalis and then you give them calcium chloride, it can cause severe bradycardia. It's potentiated by thiazide diuretics, and it's incompatible with most other medications, so we have to use either a different IV line or flush it well between medicines. Typical adult dose: 500 milligrams to 1 kilogram, or 500 milligrams to 1 gram via IV or IO, slow push. And pediatrics is usually 20 milligrams per kilogram. Duration: effects onset is pretty much immediate, peak effects immediate, and then usually hangs out in the body for 30 minutes to 2 hours. Something to keep in mind with it: it changes the cardiac electrical threshold so the heart doesn't depolarize as easily. And that's kind of the basis of it. It is 3 times more potent than calcium gluconate, has just a slightly different molecular structure, so it is more potent. And then it's going to be up to your local protocols as to if you carry either one of those or what they choose for you to carry.